So I'm going to go ahead and just kick this off and say, welcome everybody. My name is Kat Pippoli, and I am the Chief Impact Officer with Kronkosky Charitable Foundation. I am delighted that we are able to offer this opportunity to our partners and beyond. So we opened this opportunity to talk about meaningful measurements kind of with our currently funded partners and relationships that we've had before, and maybe with some partners that we've never met before. And that's great. We are talking about meaningful measurements as a team. We're talking about it with nonprofit partners. And so what we wanted to do today was really just level set and say, how do we have this larger conversation and share what Kronkosky is viewing as meaningful measurements in nonprofit and really what we mean by reframing accountability. I think you may have heard us, Laura Vaccaro, our CEO, if you've come to any of our community convenings or if you were at our open house, a big thing for us is how are you measuring success? We don't want to artificially insert something for you to reach a bar. How are you measuring success? How are we quantifying that success, not only to secure investments from Kronkosky, but from other funders as well? The stronger our nonprofits are, the stronger our community is. And so really that's the approach we're trying to take, is understand how you're measuring success, how we're quantifying the work that you're doing, so then we can articulate what that movement is in these particular areas and improving the conditions for individuals within those focus areas. So I am delighted to pass this to Jennifer and Kathleen. We do a lot of work with Denny Data Strategies and Moriarty Consulting Group. They have supported us with our strategic alignment. Kathleen, Dr. Denny has supported us on the data science side with other partners as well. And so I'm just so grateful to them for being on today and providing this training for us so we can dive in deeper. So Jennifer, Kathleen, I will pass to you.
Thank you, Kat. Welcome, everyone. We're excited to be here. I'll tell you a little bit about Kathleen and I. We have our own consulting practices. Mine focus on facilitation, governance, and strategy. And Kathleen is rooted in data and evaluation. We often collaborate to support nonprofits during strategic planning and other moments where clarity, direction, and accountability really matter. So today we're going to, as Kat said, reframe how we think about data. So today's session is really all about shifting how we think about data, not just as something we collect for funders like Kronkosky, but as a tool to help us improve programs and serve our missions more powerfully. Each of you will have different data needs based on what you're trying to make true in the world through your work. And our goal is to help you get clear on why you measure, what you measure, and how to use data in a way that truly supports your clients and your community as the primary focus. So I'm going to kick it back over to Kathleen to, nope, I'm not. I'm going to share my screen. We practice this. I'm going to share my screen because I want to hear what you guys have to say using Mentimeter. So you should now see the Mentimeter screen, and you can on your phone, if you have that next to you, or you can open another browser window and join menti.com and use the code that you see there on the screen, which is 77989924. And the first question is asking you, I'm sorry. The first question is asking, do you collect data at your organization? Just yes or no. All righty, seeing lots of yeses. Fabulous. Well, this is a good start, and that's the first start, actually collecting information. Righty. So I'm going to move us on to the second question. This is going to get a little deeper. So of the data that all of you are saying you do collect, how much data do you actually bring in? You might choose we don't collect data. but I don't think that's the case here. Some data, plenty of data, and actually more than you know what to do with. And again, that code is 77989924.
You can also find it at the top of the slide that's on Jen's screen right now.
Yeah, thank you. Thank you. Somebody cued me that somehow you guys could answer the first question, but not this next one. So thanks for sending that nudge my way. Plenty of data. Wonderful. All right. Nice. All right. Let's look at the next slide. All right. So this is an open-ended prompt for you. What's your organization's primary purpose for collecting data? And all answers are good answers.
Also, anonymous answers, one of the great things about Mentimeter.
Yeah, true.
I'm going to jump in here now as responses are coming in. Good morning, everybody. Thank you so much for having us this morning. I'm Kathleen Denny. Thrilled to be here with you all and Jen and Kronkosky to talk about my absolute favorite topic in the world, meaningful measurement. So thank you all for letting us join you this morning. Let's see. I see the word grant jumping out at me. This is qualitative analysis in real time. So I'm looking for themes very quickly as I read. I see measuring impact of programs, grant writing, funder, grant, annual report, grants, marketing, grants. Okay, so if I put this in a word cloud, I think grants would show up. I see to tell our story, tracking, measuring impact. Okay, grant writing, reports, grant writing, contract measures. Awesome. All right, so we're starting to see, just quickly, right, as these responses come in real time, an emphasis on outward, right? Grant reporting, grant writing, storytelling, all important, right? All critical purposes and uses of data. But what we see less of here, although not none, less of is measuring how we're doing, right? For our own internal purposes of assessing impact. Let me put our deck back up and move us into what we're offering today is kind of our major theme, which is reframing accountability. We want to reframe in this webinar today. We want to reframe accountability in two primary ways. The first one is flipping the script on funder accountability. Right? I think we're pretty familiar with that phrase. Your responses to the mentee suggest we know what it means to be accountable to funders, to provide data for reporting, right, for accountability. And we're suggesting let's flip that. And instead of thinking about our main purpose of data collection is to be accountable to funders, let's have the main purpose of our data collection be to be accountable to clients. Accountability to clients. And what data do we need to collect to ensure our programs are serving clients, whoever our clients are, to the best of our organization's ability, and tracking, monitoring, assessing change in clients rather than having our primary purpose of data collection be to satisfy funders. We'll get into this kind of script flipped a little deeper, but it's not to say that, right, funders, external stakeholders, interests don't matter. That's not what we're here to say. We're just trying to reframe the emphasis that we all share, funders, external stakeholders, you internally. The driving force behind collecting data is to ensure program improvement, to assess programs and drive improvement. That's what we're all looking for. And so let's zero in on what clients need from our data first. And that, believe it or not, will serve all other interests. And the second way we want to reframe accountability is to de-jargon the results-based accountability framework, or RBA. You may or may not have heard of this framework. You may or may not use it all the time. But RBA has some really powerful principles to it, but sometimes it's hard to get our heads around it if it's too jargony or feels too much like the words, the vocabulary matters. We want to get down to the meaning of results-based accountability. All right, prioritizing data for program improvement. So these concentric circles, typically we see them flipped, right? We want to collect data to satisfy funders first. And then we use it to communicate. I saw annual reports as part of why you collect data. And sometimes if we have the capacity, right, and the ability in our organization, we use it for continuous improvement within our organizations. We want to flip that emphasis and say all data we collect should be in service of program or organizational improvement to best serve our clients and to best serve our mission. Then a subset of that can be used to communicate and report. So we strive for a data collection strategy where the primary purpose is to improve programs for clients' benefit. And the important thing here is if the data can't be used to improve programs or better understand your clients, it's likely not a meaningful data point for funders or to report out either. So use data to be accountable to clients first is kind of the mantra of today. And please do put questions in the Q&A. Jen's going to be monitoring it. If we need to stop at any point, we will for clarification. Otherwise, we have time protected at the end for just a group discussion.
You know, Kathleen, I think your point about if it's not meaningful to them, it's not meaningful to funders is pretty spot on, especially with the conversations that we've had with the Kronkosky team over time, because their trust asked them to improve conditions in a number of different focus areas. So they're really not able to kind of manage their fiduciary responsibility to the trust if they don't know that those grantees that they're supporting are making an impact. And so it really goes hand in hand.
Well said. Okay. So even if we accept, right, when we accept the idea that data is for clients and program improvement first and foremost, we still need to understand and think through what do we want to measure to see if clients are benefiting, right? To see if our programs are quote unquote successful or working. And for that, we need our recipe for impact. You can call a recipe for impact all kinds of things, and we do in the evaluation literature. You can call it a logic model, you can call it a theory of change, a theory of action, an outcome sequence, right? There's all kinds of different names. I have their little definitions right here, but they all boil down to this kind of very brief, right, sequence down here that I'm circling. This is your recipe for impact in your organization. Your inputs, what you as an organization are putting in, programs, your efforts, your deliverables, things that your organization is designed to deliver. Then the outputs, those are how much uptake is there of those inputs, of those activities, the participation and the accomplishments of the program. And then the outcomes, right? The outcomes is, did it really matter? Did it have a real impact or benefit for the people or entities or clients you're serving? We can think of benefits in the short and the long term, right? Short-term benefits, long-term benefits, short-term outcomes, long-term long-term outcomes. And I have here in the text, for many nonprofits, decisions about which data points to collect are funder driven, right? If I ask a client, why are you collecting this data? Often, not always, but often the answer is because a funder asked for it. We really want the answer to be because it tells us something about our recipe for impact. It gives us insight on our theory of change or our theory of action. And if it can do that, it should be able to satisfy a funder's interest in monitoring that very same thing. Let's look at a few, right? This is a colorful slide. And these are all different types of recipes for impact. This down here is a logic model. This up here is a logic model from the 90s from United Way. This is a theory of change model, all from different organizations, right? Everybody has their different spin on logic models and you know how to write one. And I think that's the kind of the message that we're trying to get here with de-jargoning things. You can go to some wonderful institutions, right? Urban Institute, Annie E. Casey, they all have great toolkits for how to put together one of these recipes. And we want to emphasize there's no really right or wrong way. There's no better or worse tool. It's just, can you lay out a visual path of impact that culminates in the intended benefits, right? You can see they all move from left to right, down to up to down. They show the path. If we do this, then this happens, and then this happens. Recognizing that there's extenuating circumstances, there's all kinds of conditions and factors. Often we see that at the bottom of these logic models, factors out of our control. But in a perfect world, we do this, and it leads to this, and it has this intended impact. That's what a recipe is doing for us. Let's zoom in on this, as my children would say, document from the 20th century, this 1996 logic model from United Way. And just to give you a real sense of the same sort of basic structure, what we do, what we put in as staff in our organizations, how many people are taking us up on that, or how many entities, right, are taking us up on that, or how many things we're producing as a result of that. And then did it have an effect, benefits or changes for participants during or after program activities? And we often talk about, an effect or a change in terms of knowledge. Did it change what they know? Did it change skills or behavior, right? How they act, what they have the capacity to accomplish, changed attitudes or values. These are all sort of in the short term. To modified behavior, we think of that as midterm. And then an altered status, an altered way of living or life trajectory, that would be a long-term benefit, right? A long-term ideal benefit of our program. Let's keep digging into outcomes, because this is where we're getting into the language of results-based accountability, or RBA. Like we've been saying, a program or organization's recipe, and you can have it at the organizational level, and within an organization, you can have multiple recipes at the program level. So you kind of zero in on a particular program's recipe. That guides you on what to measure, on the important elements to measure. And then a framework like RBA guides you on how to collect meaningful data points to help you understand whether your recipe is working. The vocabulary of results-based accountability is less important than its intent. So we want to de-emphasize jargon and focus on the intent of meaningful measurement in RBA. You may be familiar with this RBA matrix. This comes directly from the RBA origins, which is Mark Friedman's Trying Hard is Not Good Enough. And it provides guidance on meaningful measurement with these three kind of simple but effective questions. How much did we do? That's your output, right? How much did we do? How well did we do it? And is anyone better off? This is the impact, the change. Did it matter? How much, how well, and is anyone better off? And all three levels of measurement are important. We also don't want to suggest that you're only looking to measure better off, right? Even though it's the most informative about how effective your programs and organizations are running, the others, this quantity, how much did we do and how well did we do it, those are also key pieces of information for understanding that whole recipe, right? That recipe from beginning to end, how much we did, how well we did it, and is anyone better off? So here we are just going deeper into describing these types of meaningful measurements in a way that maybe some of these resonate more, depending on how you're entering this conversation. So we've got at the top kind of synonyms, right? How much is participation or production if you're not a direct service organization? How well is the quality of that service? And we can measure, operationalize, if you like that term, we can measure these with all kinds of different measurements, quality, production, and then the benefit, is anyone better off? And so in this second row here, I've got common examples of how we're measuring these in our day-to-day worlds. How much is how many people attended, how many sessions you offered, right? That's an output. That's a participation or production indicator. Examples of how well, we often look at satisfaction ratings for how well an session was offered or how satisfied people were with that offering. Return rate, right? Whether we came back, whether clients came back is a great example of a how well indicator. And then changes to, as we said in the previous couple slides, changes to knowledge, skills, behavior, attitudes, and conditions. Those are all better off examples. We often get these, and we'll dive into this a little bit later. We often get a lot of these from surveys, pre-post surveys, from for student serving organizations, from assessments, right? Things that we can get from report cards or things that show us change over time.
So I would suggest that if you're looking for how are we defining better off, it most likely is directly embedded in your mission statement. You're saying something about we do this for so-and-so so that X occurs. And the X that occurs, you're stating what your impact is. But often when you're writing annual reports or something like that, you're really kind of talking about how many you did and how many came back, and you're not really reaching into, but do we know if their lives actually changed? There was a change in behaviors, any of that. I did have one question pop up that might be relevant right now, Kathleen, and that was, what if your main clients are children? How do you gain that information about better off if the clients are children? Who would you be asking?
Great question. I think we're still going to be interested in better off in what way, right? It'll matter what kind of service you're delivering and for what purpose. But let's just take the children themselves because they're minors. You can still survey children, right? If you have a consent agreement with their guardians. So a lot of nonprofits still are able to survey children because they have a data consent, right? Consent form signed by their parents as part of the standard enrollment paperwork. You can also, and through intermediary organizations like a partnership, you can have data sharing agreements directly with schools for academic data, attendance data, behavioral data. That's very rich data. Schools collect, as many of you are probably aware, schools collect a ton of data, but quite rightly, they protect it, right? It has to be very protected by federal regulations like FERPA. And data is, we all have to, and we should do a webinar. Our next webinar should be on data security, right? We really need to protect the information that our clients are willing to provide to us, especially if it's sensitive information. So anyway, the schools have a lot of great data, but protect it. And so you need to, you can enter into data sharing agreements with schools, either directly or through an intermediary like UP. And that can provide a lot of information over time about how children are doing. Oh, last thing I'll say about that is I've been having a lot of fun recently working on gamifying survey data collection for the youngest children. The youngest I've done this, that I've created these protocols for, is 6. Earlier than that, you want to rely, and even at that age, you can also rely on guardian and teacher feedback. Those are all stakeholders or people in their orbit who have strong connections with the child, who are with them all the time and have reliable assessments of their behavior or whatever indicator you're monitoring. You can definitely talk to the adults in their orbit as well. So directly to the children, directly to the adults who support the children, or to the institutions that they're part of, like schools. Okay, so finally, I want to just hammer home this intent part. It's not about the vocabulary. It's not about what words you use. It's about the intent. So this how much intent tells us about the amount of work that was done. The how well intent describes the quality of the work that was done. And the better off intent describes the effectiveness of the work that was done. All 3 of those together tell a comprehensive story, measurement story of your recipe of success, right? Here's another example. This is from the Urban Institute, a great resource for ideas for indicators, like actual measurements to use or outcome statements. And we have a link at the end when this deck gets sent out. We have a link to a really awesome repository of information that the Urban Institute maintains by sector, right? This is for youth development, but they have all kinds of sectors represented on their website. So let's take a look at, just as another example, this recipe of success. You can see, again, it's visual, moves from one end to another, tells us where we start, various activities to recruit youth and mentors for this particular youth mentorship program. Youth enroll in mentoring program. Youth participate in mentoring program. So this is kind of their pathway of success, and this underneath is how they're measuring it. Number and percent of youth participating in mentoring. Just on your own, right? How would you, in your own self-quiz, what would you call this one based on the meaningful measurements that we've talked about? Number and percent of youth participating. Is this a how well measure, a how much measure, or a better off measure? I would call it a how much measure, right? The number who are involved in your programming. But then we keep going with increased study hours outside of school, improved school attendance, improved emotional well-being, and improved social behavior. To me, these are all very strong better off measures. And for Urban Institute and for this recipe, they're saying these 4 measures of better off are important predecessors to improved academic achievement, continued educational advancement, and ultimately, here's our long-term outcome, established employment and gainful career. But what I love about this is that they're showing us that we're not just going from, we had, youth recruited in a mentor program all the way to so that they can have a gainful career, right? Or gainful employment. We're showing the kind of zooming in or using a microscope to say, yeah, but what needs to happen? What dominoes need to fall to get to that employment or career? And they've broken it down really nicely into these different elements. And then we measure each of these different outcomes or elements of better off to see if it's really happening, to see if we really see the benefit that we expect. And if it isn't, Then we kind of dig into which part of our programming, which part of our inputs may not be as effective as we think they are, or we want them to be. All right, let's get back to you all. I can stop talking for a bit. You can stop hearing my voice for a minute and talk about your outcomes. So I'm going to stop sharing, and Jen is going to put up the Menti again. And I'd love to hear your outcomes. We want to just get the juices flowing for one of your organization's cornerstone outcomes, right? If you have one. If you don't, think of it this way. What is one of the key benefits you expect your clients will receive or develop from their participation? Literacy, excellent, right? Changes to reading or ability to read. Better health, perfect. Improvement in school attendance. These are all excellent better off measures. Confidence. Confidence is a great one. Confidence, and I see confidence as one of those great intermediary outcomes, meaning it's hard to get better grades or better, to see success on all kinds of levels if you don't feel that you deserve it, right? Self-esteem and confidence are really important precedents or precursors to other behavioral change. And in my opinion, we don't measure it enough in the nonprofit sector. All right, knowledge and tools for success. They can thrive as a family, leadership, earn a living wage, great, healthier relationships, age safely in their homes, gain a more positive view of themselves, social inclusion, okay? Animals find their forever home, great. Access to communication. That's an interesting one. Access to communication. Increase in musical knowledge and musicianship. Oh, okay. Well, that's what we've got. No more.
I don't know what happened there.
Okay, we've reached the end of our presentation.
Hey, Kathleen, would
yeah.
you talk a little bit about what we sometimes see with our clients and assumptions around, because I do this, I know that I'm making this true for my clients, but where you might struggle with, how do you know that it was your intervention alone that actually made that true? And how do you kind of manage that?
Yeah, that's great. So is that a question in the chat, Jen, or are you thinking it just came to you right now?
It's just my question. It's something that you and I see often.
We definitely do. And also I'll say just a little bit right now, but then toward the end of this presentation, we're going to talk about the relationship between the client population who you directly serve and the whole population, right? Who you serve, or who's served by you, and then the rest of the community, right, around them.
Perfect. The deck's
but
not
it
up
is
right now.
Say again, the deck's not up. Okay, let's get back to it, team. Thank you for sharing your outcomes. I think some of those were really fabulous and great cornerstone outcomes, whether you're currently measuring them or not. It's great trajectory. Let's take a real quick pause on what counts as data. And I agree with Kat. I want to echo Kat for your fabulous registration questions. I read every one of them. They were so helpful in understanding kind of the breadth of questions and issues and challenges out there. And throughout the webinar, we're trying to address some of the key themes that we saw. But one of them was this, like what is data, right? What counts as data, which is a fabulous question, right? But data itself can feel like a jargony word and a very loaded word. So let's just break it down a little bit and ask, what does data mean? Starting with the words quantitative and qualitative. So data comes in two basic forms. Quantitative data, those are numbers, counts, anything with units, right? Measurements with units, quantitative data. We can get quantitative data from lots of different places. One of the primary places we get quantitative data is from surveys, from test results, but even sign-in sheets, right? Counts of people is quantitative data. So if 40 people came to your session, that's a quantitative measure of attendance. And then if 40 people came, but let me do it. 50 people came, but 100 were invited. Now that's maybe more of a bridging into how well you did it, right? Because only 50% came. So we want to somehow maybe change our approach, change our communication, change our incentivization to get more people there, right? So right now we've just described 2 key quantitative measures from your registration sheet alone. All right, qualitative data can be so valuable, so rich, and also so intimidating because it's the words, it's narrative, it's observations, it's pictures. We can get qualitative data from all kinds of places. Interviews and open-ended surveys. So surveys themselves can have quantitative measures like multiple choice questions, and they can have qualitative measures like open-ended questions. Tell me how you're feeling today, or why did you answer that multiple choice question in the way that you did? People's responses to that are qualitative data. Staff observations, event descriptions, right? Those are all qualitative. And to the question that I saw in the registration questions, how do we know which one to use? My response is a mixed methods approach, a combination of the two is ideal because the quantitative results can show you large patterns of how people are feeling or experiencing something, or the change that you're seeing. If you want to measure it quantitatively through a pre-post survey, for example, that can give you great insight about patterns, both on a large scale, but also disaggregated by category or group of your population to see if people are experiencing the same thing differently. Super insightful. But then you pair that with qualitative results. Why did you answer the way that you answered? That can really help us dig deeper into the why behind these big quantitative patterns. And we can also use qualitative results as illustration of a quantitative pattern. That's really powerful in like external reporting. Lived experience is expertise. So one of the questions we had in the registration, a couple of questions, relevant questions we had. One was, how do we get people to respond to surveys, right? How can we get more participation in surveys and client data collection? Great question. And another is, how can we really foster a data culture at our organization where staff and maybe board members are more interested in engaging in data discussions and using data. And I think in addition to our script flipped around emphasizing clients in our measurement strategy, emphasizing clients first above and beyond anybody else, that will really help, I think, in fostering an interest and investment among your staff, but also remembering that lived experience is expertise. So engage your clients, your staff, your board in the data collection process, in the creation of surveys, in the creation of instruments. What questions do we want to ask? They can help validate questions and language, generate buy-in, increase response rates, and recognize and champion expertise. Go ahead, Jen. Oh, I thought you were going to say something. Okay. All right. Well, speaking of Jen, you want to tell us about an example of when it's really been used, a real life example of when data's been all come together and used at its best?
Yeah, I think that this is a really good example when you think about using the data to know if your programs are actually having the intended impact. And this comes from Covenant House, which provides shelter and services for homeless youth in crisis. So initially they were looking at transitioning youth into independent living, and they actually did some longitudinal tracking, which is not easy to do, and found that 40% of youth returned to homelessness within a year. Very disappointing results. And they started to dig a little deeper and they found that the longer they stayed in transitional housing and if they had stronger employment supports, then they had lower rates of returning to homelessness. So they went back into their programming, went back into their theory of change or the recipe, as Kathleen was talking about, to say, well, what if we extended transitional housing beyond 90 days? For those youth needing additional support? What if we added workforce development programs? And that doesn't necessarily mean that you become a workforce provider, but you start to deepen relationships with other partners and local employers. And I think that that's a question that funders are elevating, and they're really looking for those more intentional partnerships. This is a really good example of that. And then increased follow-up support for youth who transitioned out of housing to make sure that they were, stable in that. So what they found was that, in just a year, they found that the youth returning to homelessness had dropped by 15%. If they hadn't have dug into their own data to see, are our programs having the intended impact, they might have not made these really significant changes to their programming. And at the end of the day, it's not how many youth you move through your program. Their real intent is to move them into independent housing. And that's the outcome that they were seeking. But their recipe wasn't necessarily delivering on that intention. And so they really had to go back and look at that and actually had, I think, some pretty significant results. This is why this matters. And this is why funders are asking you for this. They're asking, how do you know that you're making a difference? So we know that when we invest, you can articulate that impact, that you can take dollars and translate it into the impact that you're intending.
Awesome. Great example. All right. Now we're going to shift from thinking about, or, along with thinking about our direct client impact, our impact on our direct client population. We also want to remember that, right, our client population is a subset of our whole population, whether that's our community, our county, our city, our state. They're a subset. And the results-based accountability framework, this is a visual that comes straight from RBA, results-based accountability, is to remind us that change happens on two levels. And individual organizations can't be responsible for whole population change by themselves. Whole population change comes from aligned efforts, right? What results count from Annie E. Casey, again, there's all kinds of different frameworks out there, calls the theory of aligned contributions. But it is intuitive, right? You serving 300 people or 1,000 pet owners, right? You cannot, as one single organization, turn the curve or affect the entire population of of your ecosystem. But together we can. Together, if we're working in coordination, affecting overall change at a community level can't happen by one organization or program alone, but it can come about through coordinated direct service efforts, right? Coordination among us. Policy change, if you're familiar with the upstream, downstream language, going upstream to change things at the start, at their origins, so policy change, and of course, partnership and collaboration. All organizations, no one organization can change a community on its own, but all organizations should be clear about what community level change their programs are seeking to impact. What is it that overall population change you're looking to contribute to? Isolating your contribution is not possible, right? Quantitatively, that's not a possibility to be able to isolate your contribution on the scale of the whole. But most of you on this call are probably members of collective impact networks or collective coalitions who are working towards a shared North Star goal, right? Your individual contributions add up to the ability to change community level outcomes, especially when paired with policy changes, right? Structural changes on the policy level.
So I think this is where it gets messy for folks applying to funders because funders often can say, but aren't there a bunch of other organizations doing this same work? And I think it matters that you're able to articulate this point. If your mission is all about alleviating hunger, is it realistic to think that your one organization can serve all of Bexar County and have that impact? Or is it what you need to express is we are aligning our contributions towards that goal, and the problem is this big and it takes 10 of us to address that problem, and that's what funders are often looking for. They want to say, well, who else is in this space? Are you duplicating efforts, or your combined efforts really what's moving the needle?
Yeah. And how can we tell what is happening at the community level? What are our opportunities or options, data options for understanding not just my client population, but the state of the outcome as a whole on the whole population level? And I spend a lot of my days with that question, right? For different clients and for different sectors, thinking about community level data. And this came up in our registration questions as well. How do we know what the data looks like at the community level? How can we know whether we're moving the needle in our aligned contributions at the whole population level? And so I wanted to offer 4 websites that I use almost daily. They are free, relatively easy to use, reputable, publicly accessible, and very importantly, geographically filterable so that we can get down to often we're talking about our county or our city or our collection of counties, depending on your service area. Bear Data Dive comes from CI Now, a fabulous data organization in San Antonio. It only looks at Bexar County data, but it is a fabulous interactive website, map rather, that is super easy to use and has wonderful data that's filterable down to the zip code level, which is great. Policy Map, highly recommend. It has a paid version, but it also has a great free version that has a ton of indicators across, or a ton of data points to measure across all kinds of different sectors. Also filterable down to the census tract level, many of them, but of course zip code and county as well. U.S. Census, right, the mothership of data. The U.S. Census has interactive, publicly accessible data sites. That's where we can get a lot of our information on, right, demographics. There's a lot of information about employment, poverty from the census data. And then for Texas specifically, right now, Texas has a great data portal for mostly for health data, right? Texas Open Data Portal. But so there's health data on the state website, but also the Department of Family and Protective Services publishes a lot of great data that is useful for especially child-serving organizations who are interested in, for example, the foster care system and reducing child abuse. All right, we are at 10 minutes, and we would love to use that last 10 minutes for a discussion through the Q&A, right? We would love to hear what your measurement challenges are that you think probably shared by your colleagues. We can talk through some of those. If you want to share an improvement that you made, right? If you had something like the Covenant House had, where you use data to improve and you want to share your success story, we would love to hear that and use that as inspiration for other people on the call. In the chat, or the Q&A, I guess I should say, in the Q&A, we'd also love to hear what's one insight you took away from today's session, a learning or an insight or an aha moment if you had one. We'd love to hear what that was. And then finally, if we were to offer another webinar like this, what topic would be most useful to you? Something we touched on today that we want to go deeper into, or something that we didn't touch on today that we really should have. So all of those questions, prompts are fabulous for follow-up or for discussion in the chat, we'd love to hear from you.
So Kat's also opened up your ability to turn on your audio and ask a question if you don't want to put it in the chat as well. One question that's coming through is an animal rescue organization. Should we be tracking adopter demographics? It doesn't seem too super helpful toward our mission, but someone has asked me that before. That's a great question. Kathleen and I did a strategic planning for an animal rescue organization, and that was a piece of information that we looked at. Kathleen, you want to take that one on?
So I think I could see, I mean, I think it comes down to your mission, of course, but if it can help you understand patterns in who is and who is not successfully adopting, I do think there's probably value in it's kind of digging deeper into are there patterns in our, was it fosters or adopters? I guess fosters and adopters. And is it, are our younger adopters more or less likely than our older adopters to keep their pets, for example, would be a really fruitful question. It may not be something you report out. And if you go back to our concentric circles, we're suggesting that the data you use to improve, that's your biggest circle. So you may not be reporting out each of these. It may not be something that you need to share out externally, but it could be really a really useful piece of information if you find that, yeah, there are some demographic patterns in our foster population or our adopter population that are associated with better or worse success rates. Then you can use that for program ideas, right? Do we need to provide more resources to our younger adopters, for example? Or I can't think of another demographic at the moment that may be helpful, but that would be an example of how I might use that information internally.
We've got another question about specific tools or sources we could use to help improve data collection with children. They're interested in your gamifying idea, as well as tools similar to Menti that you think would work with youth.
And what age children are we talking about? Are they in school, and what kind of program impact are we hoping these children receive?
I'll see if she pops back on with that. Somebody responded and said that we've started to use emojis to help survey children, especially those that are nonverbal, and that it's specifically in the IDD space. And then somebody asked, would that be acceptable to Kronkosky? Well, yeah, I think so. I think you could easily translate that into sharing your outcomes. Somebody said,
Can I leap in there real quick for the emojis?
Yeah.
Team. So 1 to 3, 1 to 5, those emojis just get substituted for numbers when you report out. So the child sees an emoji, right? The child sees, like you do at the doctor's office. That's been a staple for years at the doctor's office. Tell me what your pain level is, right? They do it for adults too. And so then you you choose the emoji. Then you just translate that into numbers for your own purposes and for your own analysis. So the worst face, right, the least pleasant face is a 1, and the most pleasant place is a 5, or whatever your range is. And then you do the same quantitative analysis you would, whether no matter how you ask the question.
Here's one that you'll appreciate, Kathleen. Somebody's talking about being with a theater organization.
Nice.
And that they've teamed up with that partnership to provide more information, but what's really coming through is that we aren't collecting enough to show our impact. Other orgs more connected to schools have access to things like student IDs. How do we, as a similar nonprofit, get those inroads that would allow us to access student IDs and show how attending performances supports impact?
So in this example, you are connected with that partnership to see what are you getting from that partnership if you don't have student IDs. I'm getting the sense that they don't have, they're not collecting student IDs. And for those of you outside of the youth development space, the youth development organization will collect the student ID, and then you match that to the school's data on the student with the student ID. And so once you have that match on student ID, all that student information, grades, behavior, attendance, that can come over to the youth development organization to analyze, but you need to have that student ID to match it. So if you don't have that student ID, what are you getting from up?
Yeah, there's a couple that are talking about difficulty getting student IDs. Another
Yep.
similar organization is
Yep.
talking about, yeah, how do we measure long-term tracking when we only have capacity to track zip codes and we offer dozens of different programs across different formats, exhibits, outreach, professional development, etc.
Yeah, the arts is such an interesting, it's right, a fabulous, vital, necessary sector. And to measure impact at the individual level is difficult because contact can be fleeting, unlike a youth development organization that has the same children or the same young people for maybe years at a time. Your contact with a museum or a theater performance may be a one-time thing. And so to be able to track impact at an individual level, that might not be how that might not be the outcome at the arts for particular arts recipes or recipes in arts organizations. I think we would really have to take a look at the logic model or the recipe of impact and see, are we looking to make an impact on an individual? Well, I think we would just come down to the what the recipe says, and then we would try to measure the recipe to the best of our ability, knowing that we can't get, maybe we won't have contact with the same people, but can we get a one-time shot, right? A one-time day of, or in our registration, can we get some information about, how access to us and was it hard to get to us? And I think the arts organizations, we could have a great deep dive brainstorm on measurement in particular, outcomes measurement.
We have a couple of questions about recommendations for analysis data, collecting different software that could help them collect and analyze data. Any thoughts?
That's the question or the recommendation? Oh, they're asking for recommendations?
It's a question. Can you suggest an analysis data collecting software that doesn't cost too much for smaller nonprofits?
Sure. So the collection is, let's separate collection and analysis, right? You can collect information for free using, if you're on the Google platform, you use Google Survey, right? Google Forms. If you're on the Microsoft platform, you use Microsoft Forms. Those are free platforms. All of the, the Survey Monkeys of the world, SurveyMonkey, Qualtrics, JotForm, they all have free versions. They're limited in the number of clients or people responses you can gather. But the free versions are through your enterprise, whether it's Google or Microsoft. You could also just do paper, right? If you need to be on paper, you can hand out paper forms and then record those in Excel. Whether you're in Microsoft Forms or Google Forms, that information will go out to your clients. They'll fill it in. The data will be captured in an Excel spreadsheet. Or for Google, it's Google Sheets. For Microsoft, it's Microsoft Excel spreadsheet. And then that's where you do your analysis, is in that Excel spreadsheet. And you can do using pivot tables, right? You can do quick analysis of number of people who responded, percentage of people who responded in particular ways, but the analysis is up to you. Data collection can be free, and then when the analysis comes back, when the data comes back, you do the analysis. And it can be, these do not need to be complicated or involve statistics, right? We're talking about percentages, averages, and counts, even for better off, right? Just because we're talking about better off measures doesn't mean the statistics change or the calculations change. It's really about the questions that we're asking.
So somebody raised the point, and we've seen this too, right? When we work with clients and we're looking at our own options, how do you get enough responses post-program to have valid outcomes? How do you get them to take the survey to begin with?
Yeah, great question. So, yeah, one thought or one recommendation is to bring them into the process. So like we said in that slide earlier, clients have lived experience. They can help provide the most valuable insight on the way to word the questions, the method to deliver the surveys, right? It may be you're delivering the survey via email and they're not looking at email. It needs to be delivered via text. And so there you go. We can do that. And that could really open up some response rates. That's one thought. Another thought is to run the final survey when you still have them. So don't wait until they've left. At the end of the last session, run the survey when they're there in person, or if they're, if you're on Zoom or whatever. And the last thing I would say is incentivize it, right? Attach an enter to win for a drawing, or if you have the means, a guaranteed $5 or $10 HEB gift card. It works.
Yeah, we just looked at a platform, Kathleen. I sent that over to you just this week. And it's a way to, at the end of the survey, click on a QR code that takes you to another platform. So you still maintain that anonymous survey, but then it takes them into getting the $5 gift card or the drawing or whatever that looks like in a free platform there. We're at 10:01 and thank you all for all of the questions that you put in the Q&A and for all the suggestions for future information that you'd like to see. Somebody shared for a future webinar, I'd be interested to divide into categories of demographics served, such as arts, health, animals, etc., so that we can learn practical approaches to collecting data and impact sharing. You are spot on with that comment, and you can expect more to come out of Kronkosky for that, since this is a continued journey that we're supporting for them as well. So I would say more to come, and you guys, fabulous questions, fabulous comments. This was just intended to be kind of an intro webinar, so hopefully we've got you thinking, that you'll reach out with more comments and questions, and that you'll show up for future sharings that we're going to have. And I will turn it back to you and Kat.
Great. Just a huge thank you to everyone for participating. Just a reminder, we will send out the recording as well as the deck so that you have this resource, and we will keep you updated as we plan the future webinars focused on those particular areas. So we're grateful for you participating today and look forward to connecting with you all soon. Take care.